Welcome to the deep dive. We're really excited today. We've just launched something new over on the Book Podcaster's YouTube channel.
Oh, yeah.
Yeah, it's called Drug of the Week. And this deep dive here, it's going to feel pretty similar, actually. We're taking a close look at a really important medication,
Okay.
especially for all of you, future nurses, current nurses, anyone prepping for the NCLEX or just wanting to be really solid on their meds. Think of this as your audio guide.
That sounds great. And timely, too. So, which drug are we focusing on today?
Aldesleukin, also known as Proleukin.
Aldesleukin? Okay, yes, that's definitely one you'll see flagged as high alert,
Mm-hmm.
and for very good reasons.
Eye alert. Okay.
It has some pretty significant effects on the immune system. It's mainly used in cancer treatment, so yeah, understanding it properly is crucial for safe practice.
Okay, aldesleukin. So to get us started, what are the absolute must-knows, like the foundational things we need?
Right, let's nail down the basics first.
Yeah,
The generic name is Aldesleukin, brand name Proleukin.
got it.
Therapeutically, we classify it as an antineoplastic.
Antineoplastic, so cancer fighting.
Exactly. And pharmacologically, it's an interleukin,
Mhm.
specifically interleukin 2 or IL-2. Interleukins are, well, they're key signaling molecules for the immune system.
Interleukin 2. Okay, so it's definitely tied into our body's defenses. How does it actually work then against the cancer? What's happening biologically?
Yeah, what's really interesting is that aldesleukin basically supercharges the body's own cellular immune response.
Supercharges it.
Yeah, boosts the production of several really important signaling molecules, the cytokines. You can think of cytokines as kind of the messengers for your immune cells.
Okay.
Specifically, aldesleukin increases tumor necrosis factor, TNF, interleukin-1, and gamma interferon.
Right, TNF, IL-1, gamma interferon. And when those are ramped up, what's the direct effect on the cancer itself? What are we hoping happens?
Well, the big picture is that this surge in cytokine activity helps the body inhibit tumor growth. Aldesleukin has shown it can cause tumor regression.
Regression, okay.
And its main approved use, its indication, is for treating metastatic renal cell carcinoma.
Metastatic renal cell carcinoma. So
Mm.
kidney cancer that's spread.
Exactly. Metastatic just means it spread from the original site to other parts of the body. So yeah, the approved indication is specifically for managing metastatic renal cell carcinoma.
Okay. Now, because it has such a powerful effect, like you said, supercharging the immune system, I imagine there can be some significant side effects.
Oh, absolutely. That's a really critical point. Being a high alert drug, aldesleukin comes with quite a list of potential adverse effects.
What are the common ones we should look out for?
Common ones include things like fever, chills, and rigors, that intense shaking response.
Right.
Patients also often get GI issues like nausea, diarrhea. Fatigue is common too, and skin rashes.
Okay. Those so manageable mostly. What about the more serious ones, the ones that make it high alert?
This is where it gets really critical, yeah. Aldesleukin can lead to some severe complications. One of the most significant is something called capillary leak syndrome.
Capillary leak syndrome. What's that?
Imagine the tiniest blood vessels, the capillaries,
Hmm?
suddenly becoming, well, leaky, more porous.
Okay.
So fluid leaks out of the bloodstream into the tissues.
Yeah.
This causes low blood pressure hypotension, low blood volume, hypovolemia, fluid buildup, edema in the arms and legs, sites in the abdomen, pleural effusions around the lungs.
That sounds incredibly serious.
It is. And unfortunately, other risks include things like cardiac arrest, bowel perforation, respiratory failure, kidney failure. It's precisely why these patients need constant intensive monitoring, usually in an ICU setting.
ICU setting, right. That really drives home the seriousness. So given those risks, when should aldesleukin absolutely not be used? What are the contraindications?
Good question. There are several absolute contraindications. Patients who already have significant heart or lung disease, especially if it shows up on like an abnormal thallium stress test or pulmonary function test.
Okay.
Also, if someone had severe toxicity during previous aldesleukin treatment, that's a definite no-go.
What counts as severe toxicity?
Things like sustained ventricular tachycardia, that's rapid heartbeat for 5 beats or more, angina, or heart attack, needing intubation for respiratory problems for over 72 hours.
Okay.
Pericardial tamponade, which is fluid around the heart, severe kidney problems needing dialysis for over 72 hours, major CNS issues like a coma or psychosis lasting more than 48 hours, intractable seizures, bowel perforation or ischemia, or GI bleeding that required surgery.
That's quite a list.
It is. And one more patients who have had an allograft organ transplant. It increases the risk of rejecting the organ significantly.
Makes sense. Are there times when it's not completely forbidden, but you need to be extra careful? Cautions?
Yes, definitely. Caution is needed if there's a history of maybe less severe cardiovascular, respiratory, liver, or kidney disease.
Hmm.
Also, patients with a history of seizures or if there's suspicion cancer has spread to the brain, you need very close monitoring there. And we should mention that safety isn't really established in pregnant or breastfeeding women or in kids. So extreme caution there.
Yeah.
And women of childbearing potential need to be fully aware of the risks.
Right, very important considerations. Okay, so we know when to avoid it, when to be cautious. How is it actually given? The administration part.
It's only given intravenously, IV.
Only.
And the standard adult dose is very specific, 600,000 international units per kilogram of body weight.
Per kilo, okay.
Given every 8 hours for a total of 14 doses, that's one treatment cycle.
Every 8 hours for 14 doses. That's intense.
It is. Then there's usually a 9-day break, and then the cycle is repeated once more.
And you mentioned ICU support earlier.
Absolutely essential. Given the potential for those severe side effects,
Mm.
it must be administered in a hospital that has full ICU capabilities ready to go.
Okay. What about preparing the drug itself? Any special instructions?
Yes. It's first reconstituted with sterile water, then it's further diluted, usually in D5W with 5% dextrose in water. And here's a really crucial point. Do not use an inline filter when administering aldesleukin.
No inline filter. Got it. That's a key practical detail.
Huh.
Now, thinking about our listeners, the nursing students, the nurses on the floor, what are the absolute top nursing implications? What should be top of mind?
Okay, great question. Nursing care is critical here. First off, continuous ECG monitoring is essential because of that risk of heart rhythm problems.
Right, the cardiac risks.
Exactly. And keeping a very close eye out for capillary leak syndrome. We talked about that.
Yeah. What's an early sign nurses should watch for?
Often, an early sign is a drop in arterial blood pressure. This can happen anywhere from, say, 2 to 12 hours after the infusion starts.
2 to 12 hours, okay.
Also vital. Monitor weight daily. A big jump could mean fluid retention. Keep track of mental status changes. If the patient gets really lethargic or overly sleepy, the drug might need to be held.
Okay, mental status checks.
And be super vigilant for signs of infection. Sepsis, bacterial endocarditis, the immune system is affected, so risk goes up. And of course, monitor respiratory status very closely.
It sounds like incredibly detailed monitoring. You mentioned pre-medication earlier, too.
Ah, yes. Pre-meds are often given to help manage some of the common side effects, usually acetaminophen and maybe an NSAID like indomethacin for the fever.
Right.
And for the rigors, those intense chills, meperidine can sometimes be used.
So, managing the side effects proactively, what about labs? What blood work needs regular checking?
Labs are constantly monitored. You'll be looking at a CBC, complete blood count, checking kidney and liver function tests frequently.
Mm-hmm.
Electrolytes are checking those levels often. Arterial blood gases, ABGs to assess oxygenation and acid-base status, usually a baseline chest x-ray, maybe follow-ups. Thyroid function might be checked too.
Any specific electrolytes to really focus on?
Yes, definitely watch for low potassium, hypokalemia, low magnesium, hypomagnesemia, and sometimes high uric acid, hyperuricemia. And keep an eye on those liver enzymes for any elevations.
Got it. A lot to track there. So, what do we tell the patients and their families? What's crucial for patient education?
Patient education is huge. They need to know to avoid crowds. Their immune system is weaker, so higher infection risk.
Okay, avoid crowds.
Tell them to report any fever, any unusual bleeding, any yellowing of the skin or eyes, or any changes in how they're thinking or feeling.
Right, report those things immediately.
We also usually recommend using a soft toothbrush, an electric razor, just to minimize bleeding risks. And they should avoid NSAIDs and alcohol because that increases the risk of stomach bleeding.
Good points.
And for women, reinforce the need for non-hormonal birth control because of the risk to a fetus.
Non-hormonal, okay.
Oh, and also let them know they might have some visual changes, but these are usually temporary and tend to resolve after treatment ends.
Okay, good to set that expectation. So finally, how do we know if it's actually working? How is success measured?
Well, the ultimate goal is shrinking the tumor, or at least stopping its spread in metastatic renal cell carcinoma.
Right.
So effectiveness is usually tracked with imaging studies, things like CT scans or MRIs, to see if the tumor size is changing. And sometimes certain blood markers are followed too, to gauge the response.
So imaging and maybe some lab markers combined, this has been incredibly helpful, really breaking it down.
Great.
For everyone listening, especially you nursing students and NCLEX preppers, aldesleukin is definitely one of those complex, high-alert meds. But breaking it down like this, focusing on these key points. You can absolutely master it. You've got this.
Absolutely. Understanding the how the mechanism, the what could go wrong, the risks and the what to do, the nursing implications, that's fundamental for great care. Always use your resources like Davis's drug guide, ask questions in clinicals. Your dedication to learning this stuff, that's what makes excellent nurses.
That's exactly right. Embrace learning about these complex drugs. Every detail you grasp really does empower you to provide safer, better care for your patients. Thanks so much for diving deep with us today. Keep up the amazing work.